Hello friends, welcome back. My name is Dr. Vijay Bhatia. I work in the mental health as a psychiatrist. Today we are going to talk about panic disorder, also called episodic paroxysmal anxiety disorder. What is panic disorder? This is a disorder where there are recurrent attacks of severe anxiety. So panic is a severe attack of anxiety. It is not restricted to any particular situation. If it is restricted to particular situation, it will come into like phobic anxiety disorders like social phobia, agoraphobia, and with other places like in the lift, on the bridge or cliffs, other places. So it is not restricted to any situations. If in case it is situated with like agoraphobia, with crowded places or open places, then it will be known as panic disorder of agoraphobia or in panic disorder in agoraphobia. So it's important to differentiate between these two. And it is not restricted to any circumstances, either with meeting certain people or going to the party or in certain places. So it is not to the social circumstances either. And panic disorder by definition is unpredictable. It comes out of the blue as a severe attack of anxiety, and it occurs spontaneously. When we talk about severe attack of anxiety, that literally means there is autonomic arousal, muscles are tense, and there are other features we are going to talk about in more detail. So what is like a panic attack then, or panic attack in a panic disorder? So panic disorder will become if there are recurrent attacks of panic attacks, and we are talking about at least 4 in a 4-week period, or at least if it is very severe, then it will be 4 every week for at least 4 weeks. Sudden severe onset of palpitations. So this is, you can feel your heart is racing. You can hear the heart is racing. It's bouncing. And you have some chest pain or discomfort and choking sensation, as if you are not getting enough breathing, enough oxygen to the brain. You are simply as if somebody is strangling you. You may feel dizzy, and there is feelings of unreality. The world is not real, the surrounding is not real, or you yourself is not real. There is often a secondary fear of dying, as if you are going to die, as if you are going to lose the control or going mad, confused. The panic attacks are not associated with marked exertion or with exposure to dangerous or life-threatening situations, as we discussed before, that these come out of the blue. They are not associated with any particular situations or circumstances where you will feel extreme danger situation. So it is not with those. It comes out of the blue, and in between the period you might feel fairly normal and going to places, visiting friends or other things, but it happens that it comes out of the blue. Suddenly you start feeling acute attack of uncomfortable feeling with all these symptoms. There might be over a period of time that you develop that fear might come, or anxiety attack might come, and because of that fear you may not visit those places or meet those people, but that is not by definition stopping the Panic disorder. Disorder is extreme anxiety attacks out of the blue at unpredictable times and places. What is panic then? A panic attack itself. It is a discrete, means one or two and very particular time period to it. It is a discrete episode of intense. By definition, intense is severe. There's a fear of discomfort. So you know that you are going to feel uncomfortable, and there is intense fear that you will feel that. It starts abruptly and reaches a maximum within a few minutes and lasts at least some minutes. At least one of autonomic arousal must be present. Like autonomic arousals are: number one, palpitations. Your heart is racing and you can actually feel it. Pounding heart, accelerated heart. There is sweating. You get trembling. Your muscles are tense. You are literally shaking. Your mouth is dry. Remember, the mouth is dry not because you are dehydrated or been running or you have been taking some medication. So at least one of these must be present to the extreme level that we call the autonomic arousal. Other symptoms: difficulty breathing, choking, chest pain or discomfort, and even nausea or abdominal distress, like some people will describe as if there is some churning in my stomach, butterflies in my stomach. It's not all the time. It is only at the time of acute anxiety attack. If these feelings are most of the time, they might fulfill the criteria of generalized anxiety disorder. But in this case, we have to rule it out because these are discrete, isolated episodes of severe anxiety attacks coming out of the blue, causing all these physical autonomic symptoms, muscles getting tense, shaking, literally. Other symptoms include like feeling dizzy, because if you can't even breathe properly, you feel choking, or not enough oxygen going to your brain, heart is racing too fast, and you feel dizzy as if you're going to fall, and you feel unsteady, especially if you sometimes close your eyes. But in these situations, because of the autonomic arousal, your eyes are wide open, staring, and you will feel unsteady, as if you will fall. You might feel that you are going to faint, or you're going to just lose consciousness, awareness of your surroundings, and will lie down or something and feel embarrassed. You feel lightheaded. That head is just floating in the brain, in the area. Feeling that objects are unreal. You start feeling that surrounding is not real. People surrounding you are not real. The objects around you are not real. They are changing. They are different. So there is a feeling of derealization, which itself can be quite frightening and discomforting. Or even self, that you feel that you are distant, you are changing, you are not the same person. That is called depersonalization. In extreme anxiety attacks, you feel you are completely changing, different. What is happening to me? And that itself arouses all the autonomic system. Fear of losing control, going crazy, passing out, or even fear of dying. So journal symptoms can be there, like hot flushes or cold chills, and numbness or tingling. This can happen because you are probably breathing very fast. Oxygen and carbon dioxide balance is disrupted. Too much carbon dioxide goes out of your body. Your pH in the blood becomes slightly lower, and the nerve to the fingers and to the distal digits become weak, or the blood supply becomes weak, and they start having tingling sensations and some kind of numbness. The feeling is not uh, the the same. In order to fulfill the criteria for the panic disorder, we must rule out there is no physical cause to it, and no physical disorder. And it is documented clearly that things like mitral regurgitation or certain metabolic disorders like diabetes or uh, uh, hypothyroidism causing the calcium problems, even thyroid problems, and even certain breathing difficulties like people with asthma or people with COPD, although they still can have these panic attacks, but the idea is to treat these underlying causes first before we diagnose the panic disorder. Rule out the organic mental disorder, any infections in the body, even the thyroid up and down infections, kidney problems, liver problems, they all can cause confusion in the brain, therefore causing anxiety attacks. Um, Other mental disorders. So what we are saying here is panic disorder, although it on its own it is panic disorder, but sometimes people suffering with other mental disorders like schizophrenia, they go into extreme anxiety because they are paranoid or persecuted, and they get into that panic mode. So rule out they are not suffering from panic schizophrenia. Otherwise, it will be part of the schizophrenia rather than as a discrete panic disorder, which by definition is a repeated, recurrent episodes of extreme anxiety happening at least once a week, and that will be mild, or if it is happening at least uh, 4 times in a month, that will be moderate, and 4 times in a week for at least 1 month will be described as severe panic disorder. Rule out other mood disorders like depression or mixed anxiety and depression. They can have episodes of panic disorder. And rule out other somatoform disorders. In somatoform disorders, person keeps on going back to the doctor. Can you look at my heart? There is something wrong, despite all the evidence that, look, we have done ECG, all the bloods are normal, and the reassurance is not enough. The person keeps on complaining one after the other, or they come up with another disorder or another symptom and try to want to investigate that. They are never satisfied with the reassurance that nothing is wrong with you. There is no physical cause of these things. And exclude panic disorder with agoraphobia as we discussed earlier, because by definition it is not situational, it comes out of the blue. Exclude even post-traumatic stress disorder if there was extreme episode of trauma that you have experienced, like a car accident or falling from the high building, or people being kidnapped or in a war. You are not having the flashbacks. In panic disorder, there is no flashbacks. It comes out of the blue. So, as we discussed, at least 4 panic attacks in a period, 4-week period, is called moderate. And if it is severe, you will have 4 panic attacks per week over a period of 4 weeks. So every week you are getting 4 attacks minimum. When discussing about this, um, panic disorder, although there is no clear cause to it, but in general, what we have found is that patient may have underlying some kind of anxiety or anxious personality, or sometimes even dependent personality, and sometimes histrionic personality. And as a growing up, they would have experienced some kind of anxiety, some kind of embarrassing moments like wetting themselves in public places or bedwetting when indoors, and they feel embarrassed about this. So they're kind of some kind of underlying mechanisms in their brain which by adult life have been hidden in there. But these events can be triggered because they are still in your memories, and if you meet certain people, certain places or certain events you come across, subconsciously they might get triggered. And over a period of time, what happens if these events keep on coming back, and if you keep on suffering from some anxiety attack, the tolerance to these events becomes less and less, and any small thinking about it or even thinking about having a panic attack will develop some kind of fear, and that will trigger an episode of extreme anxiety calling panic attack. And if panic attacks are recurrent, then it becomes a panic disorder. This can be helped with cognitive behavior therapy, and some medications can help to relieve the physical symptoms of anxiety, but generally relaxation techniques like breathing exercises, some kind of yoga, meditation, mindfulness, sleeping well at night, and taking your physical medication regularly, and making sure the blood sugar, hydration, and those kind of things are there to help you. But CBT, the CBT, cognitive behavior therapy, is well proven to help this mental disorder if there are associated underlying depressive symptoms, because even if somebody is getting panic attacks regularly, it is bound to cause some kind of underlying mood problems with feeling low. I'm not going to better. They get negative symptoms about self, about future, about their health, and not able to cope, and their functioning gets poor. They develop low mood and depression, and that can become a diagnosis of mixed anxiety and depression, which needs treatment on its own part. Well, thank you for watching. If you like this video, please press the like button and subscribe the channel to watch more videos on mental disorder, and share with your friends. I see you again.